Today I'm going to take a second
Hello.
to talk about how food should not be a luxury and how we can create access to healthy living here in Murray. Access to healthy food should not be a luxury. Sadly, for some people, it is a reality. In communities across the country, many individuals struggle to find affordable, healthy food options. We live in a world where fast food and eating out have become so easy and popular. As a student who has observed how these limited food options can have a large impact on energy levels, focus, and health, I can confidently say a change has to be made. Affordable access to healthy food choices is a vital necessity to improve public health in our schools, workplaces, and our communities. We start by addressing high costs, limited availability, and lack of education on the matter. To truly understand the issue, we need to dive deep into the core of the issue and investigate why healthy food is not available for all. A large majority of people struggle to find access to affordable and easy healthy food due to high prices and convenience. Fruit, vegetables, and whole or natural foods often cost more than processed or fast food. This makes healthier options less appealing to people on tighter budgets or stricter schedules. Even the Center for Disease Control and Prevention agrees with this. In areas like Murray, the option for whole food markets and easy access to these foods is unavailable and almost non-existent. When healthy food is not accessible or too expensive, people tend to lead towards fast food. While it is cheaper and easier, these issues can lead to long-term health effects like diabetes, obesity, or even heart disease. As a medical student, I see how pressing this issue is and how important it is that we work together towards a solution. We can now see how availability is a major issue, but it raises a question. What are possible solutions, and where could we even begin to start a change?
Now that we understand the problem of limited access to healthy food, let's focus on solutions. Communities, schools, and workplaces all have a role to play in increasing access to nutritious food, and there are clear, actionable steps that can make a real difference. One effective approach is supporting local farmers markets and community gardens. Programs like Double Up Food Bucks allow families who use SNAP benefits to receive extra funds for purchasing fresh fruits and vegetables, effectively making healthy food more affordable and accessible. Studies show that when communities provide better access to fresh produce, people eat more nutritious foods and experience lower rates of obesity, diabetes, and other diet-related illnesses. Schools and workplaces can also make a big impact. School cafeterias that serve balanced meals with fruits, vegetables, and whole grains while limiting processed foods help students develop healthier habits. Similarly, workplaces that provide nutritious snacks and lunch options see improvement in employees' productivity and overall well-being. These examples demonstrate that when healthy choices are convenient and affordable, people are more likely to make them. Making nutritious food accessible and affordable directly addresses the barriers that prevent people from eating well. When communities provide fresh produce, schools offer healthy meals, and workplaces support better nutrition, individuals are empowered to make healthier choices. This reduces the risk of chronic health problems such as obesity, diabetes, and heart disease, and creates long-term benefits for both individual health and community well-being. Additionally, programs that support local farmers markets strengthen local economies, making these solutions sustainable over time. By taking these actions, we don't just solve the immediate problem of limited access to healthy food, we also create healthier, stronger communities. These solutions lay the groundwork for overcoming counter-arguments, ensuring that the changes we implement are practical, effective, and long-lasting.
Some people argue that improving access to healthy food is too expensive, requires too much government involvement, or that individuals are solely responsible for their own dietary choices. However, these concerns overlook the long-term economic and public health benefits of making nutritious food more accessible. Critics often claim that programs like subsidies for fruits and vegetables, farmers markets, or healthier school lunches are costly. However, research from the U.S. Department of Agriculture show that diet-related diseases such as obesity, heart disease, and type 2 diabetes lead to billions of dollars in healthcare costs each year. Some also argue that people should simply make better choices, but this ignores environmental factors. According to the World Health Organizations, limited access to affordable and nutritious food, especially in low-income areas, directly influences dietary habits and increased health risk. Additionally, a study published by Harvard T.H. Chan School of Public Health found that increasing consumption of fruits and vegetables could prevent millions of deaths globally and significantly reduce healthcare spending over time. The study emphasized that even small dietary improvements across the population can produce large-scale economics and health benefits. While the upfront cost of implementing programs and improving food access may seem high, they are far outweighed by the long-term savings in healthcare and improved productions. Preventative measures reduce the burden of chronic diseases, which benefits both individuals and the economy. Furthermore, the idea that food choices are purely personal fails to consider the structural barrier many people face, such as food deserts and income limitation. By addressing these systematic issues, communities can create environments where healthy choices are realistic and achievable for everyone, not just those with greater resources.
In conclusion, access to healthy food is not simply an individual choice, but a broader community issue that requires attention. High costs and limited availability continue to prevent many people from making nutritious choices, often pushing them towards less healthy alternatives. However, there are realistic and effective solutions, including supporting local food systems, improving options in schools and workplaces, and expanding programs that make healthy foods more affordable. While some argue that these choices are too costly and unnecessary, the long-term benefits, both improved public health and reduced healthcare expenses, these clearly outweigh the initial costs. For a meaningful change to occur, individuals and communities must take action by supporting these effects and advocating for better access to nutritious foods. Ultimately, improving access to healthy food is not just about diet. It's about building a stronger, healthier community for the future.